Good afternoon. On behalf of the Natrona County Emergency Operations Center, thank you for joining us for today's COVID-19 response news brief. For those joining us online through the Casper-Natrona County Health Department Facebook page or the City of Casper YouTube channel, we will be copying all prepared statements from today's brief into the post following today's broadcast. We also encourage you to submit any questions or concerns you have in the comments section. We will do our best to either answer your questions on air or we will reply to your comment as soon as we can following the broadcast. Yesterday, our phased reopening plan, Natrona County Coming Back Strong, was released. This data-driven plan is one that was developed in close coordination with local and state health experts, elected leadership, emergency management experts, and input from members of our community. Here in the EOC, we're taking the actions necessary to help make this plan a reality, such as yesterday, when we received approval from the state to open up outdoor dining in Natrona County with a few restrictions. Today, we're excited to announce the steps we've taken to move forward with opening up indoor dining in the coming days. Natrona County Attorney Eric Nelson is here to talk about that variance. Later, we'll hear from Natrona County Health Officer Dr. Ghazi Ghanem, who will explain the data-driven approach to the reopening plan.
Good afternoon. My name is Eric Nelson and I am the Natrona County Attorney. Yesterday, we announced that the state approved our variance request to allow outdoor dining in Natrona County. Today, we are extremely excited to announce that we have submitted an additional request to the state to allow indoor dining in Natrona County in a limited capacity. We anticipate this request being approved and effective this Friday, May 8th, 2020. Again, this is not in effect yet, but we anticipate it being approved and effective by Friday. We are announcing this now to allow our local restaurants adequate time to prepare. Many of the same restrictions that are required for outdoor dining also apply to this indoor dining variance, which includes tables must be limited to groups of 6, preferably of the same household. Tables with guests must be at least 6 feet apart from edge to edge. In waiting areas, a 6-foot distance must be maintained between parties. Signage must be maintained to remind individuals from separate parties to stand at least 6 feet apart. Waiting areas must have floor markers to indicate proper spacing. Staff shall wear face covering at all times and perform hand hygiene between interactions with each table. Cups, lids, napkins, and straws must be handed directly to customers by staff. Staff shall avoid touching items that have been placed on the table. The table must be cleared by dedicated staff once all guests have left the table. Dedicated staff shall sanitize the area occupied by customers upon departure, including tables, menus, pens, salt and pepper shakers, etc. Consider the use of disposable items if necessary. The restaurant may not operate if PPE, EPA-approved disinfectants and sanitizers, soap, and other necessary cleaning supplies are not available. Hand sanitizer must be available immediately adjacent to bathrooms. Restaurants must be closed for cleaning and disinfecting in the morning, afternoon, and evening. All tables, chairs, door handles, floors, bathrooms, and any high-touch surfaces must be cleaned and disinfected. Staff shall use gloves when handling ready-to-eat foods, including ice. Gloves are not required when handling foods that have yet to be cooked. Playgrounds and restaurants must remain closed. We want to thank everyone in our community, and especially our local dining establishments, for their understanding and patience as we all have navigated through these uncharted waters together. Again, Indoor dining has not yet officially been approved by the state. As soon as it is, the team here in the Emergency Operations Center will notify everyone through the media and social media outlets as quickly as possible. We will continue to work together with our health experts and local and state officials to evaluate the progress we're making here in Natrona County and take slow, data-driven steps to safely reopen. We'd like to thank you for your continued support. Additionally, I would like to notify the public that the Natrona County Commissioners will be meeting this afternoon to discuss steps to open the Natrona County Courthouse in a limited fashion. While we don't have specific concrete dates or steps, we anticipate the courthouse being opened at least in some capacity no later than next Monday. Once that has been determined, we will let the public know what services are available. Thank you very much.
Good afternoon. I'm Dr. Ganem, and today I want to really touch base about where we are in this epidemic and where we're heading. COVID-19 has changed our lives and the way we do things, the way we interact, and it really is something that happens probably once every 100 years, that if it has really profoundly impacted our community and changed the way we do things. I would like to take a minute here to just acknowledge all of you there, the Natrona County community, the people out there who have really been very patient throughout this whole process. I think that changing the way we live, changing the way we interact is not simple. And we are in a good place right now, and the only reason we're in a good place because everybody came together and tried to do the right thing. I want to also take a few moments to reflect upon what has happened over the last few weeks. How did we get here? And after that, we're going to talk about our reopening plan, where we're going to go next. And then there will be some time for questions as well. First, I want to thank everybody for their hard work here at the EOC. I want to thank the people who have worked tirelessly at the Natrona County Health Department, the Wyoming Medical Center, the local physicians, state authorities in here, local authorities, everyone who has really come together during these unprecedented times and really has made the response in Natrona County just absolutely fantastic as far as where we are and how we got here. Remember, we are dealing with a virus that has shut down the world economy. We are dealing with a virus that has ravaged communities. We are dealing with a virus that in the United States has resulted in more than 50,000 deaths. Once we put this in perspective, when we look around us, we feel very blessed and very lucky. And the fact that we have not seen this ravaging our community is probably because of the hard work of everyone and maybe also the geography of our rural area. So the EOC over the last few weeks has really done a fantastic job. And it starts really with like simple things as putting out there in the community hand sanitizers and working with the local distillery to get this done. This has happened in a time where there was no hand sanitizers. We tend to forget these small things, but these are the things that really make a difference. The EOC have really worked very closely with WMC and the Natrona County Health Department and the State Health Department to provide the testing when no testing was really widely available out there. All this really has allowed us to recognize the cases, to do contact tracing, to quarantine the cases, and to avoid a widespread of the virus. in our community. Also, we had like some local communal settings that had suffered through outbreaks. Talking about WBI, who everybody knows how hard it had been for those guys to go through this. And we worked very, very closely with those guys. And we're all in a better place right now. We've asked several times that the public continues to bear with us and try to protect the vulnerable amongst us. And we've asked several times, and we still ask, that everyone have masks on when they interact with others, obviously. There are all the social distancing guidelines that everyone knows now and probably is tired of us repeating them, but it's really super important so we can move forward. I'd like to start by looking a little bit at the data that we have, because we really want to have a data-driven plan so that everybody knows why we're doing what we're doing. And it's not like we enjoy what's going on right now. Absolutely not. We all want to go back to our normal lifestyles. So I'm going to start with the first, can you tell me what?
So the first chart that we're going to see are the numbers of respiratory screening clinic patients showing flu-like symptoms.
Can't see it in here on this screen, so that's anyway. So the that particular graph looks at the number of patients who had presented with flu-like symptoms March through April, and who had been seen at the clinic that was started by Wyoming Medical Center. As you can see, there has been a significant and gradual decline of the flu-like symptoms in our community. Next, please.
The next graph we're looking at are the next graph we're looking at are the weekly average number of COVID tests performed in Natrona County.
And this actually somehow reflects initially the availability of testing, and we had stringent testing criteria, things that have changed throughout. And the next graph that we'll see.
The next graph that we're looking at are the daily number of confirmed COVID cases in Natrona County.
And as you can see also on this graph, we had several spikes, but overall we had a nice decline of those confirmed cases. We haven't registered any new case since practically April 23rd. We have wanted to at least have 10 to 14 days of no cases so that we can go from the high risk group to the lower risk group. We have developed a plan that goes across multiple industries and different activities. And the plan is actually can be looked at as a way to emerge out of this crisis that we're in, starting with the high risk, and then moderate risk, and then low risk, and probably after that the new normal. I want you to remember that this COVID-19 is a virus that probably will not go away. It probably will reemerge with us again sometime in the fall. And right now, though, what we are looking for is a gradual decline and and to keep our numbers low so that we can go from one phase to the next phase and open up. I hope that this plan will be implemented by the public, because it really takes everyone and the society really implementing it. And this is a voluntary kind of implementation in a lot of ways. We really want our social discipline to take over, and for us to be able to go from high risk to moderate to low risk groups. We want to see over the next few weeks a stabilization and a reduction of flu-like symptoms in the community. number of testing can go up, but what we don't want to see is any uptick in the number of cases. I also want to remind you that we are not living in an island, and we have some other communities in the state of Wyoming who still are going through major outbreaks. And as we all know, there will be traveling back and forth, and always the possibility of introduction of the viruses again and again in our community. Having said all that stuff, I'm going to just take a few questions and then
Doctor, our first question today. Natrona County's positive numbers have stayed relatively flat for just short of 2 weeks now, despite our daily testing remains relatively steady. Can you shed some light on why you think our numbers look like this, and is this a false look at cases in the community?
I think our numbers look good because there are many reasons. One of the main reasons is we have established in place a way to identify the infections and then isolate them and control the outbreaks. Do we have other COVID in the community that is not showing up? I can't say yes, I can't say no. The odds are we do have it because it is something that can cause no symptoms at all. We are not an island again. I'm sure there is like back and forth to other communities. What we want though to see is that over the next at least 2 weeks that we will stay low. And I think as time progresses, we will have more certainty about, I can't say no cases or no transmission in our community, but I can say that that will be helpful in us moving forward and opening up.
Our next question is specific to the reopening plan. Right now we are in the orange or moderate risk category. What will it take to move into the yellow or low risk category, and when do you expect us to get there?
There are different criteria that we're going to go by. One, on a local basis, what we have done is we centralized the testing, and this gave us the opportunity to actually track the number of flu-like symptoms in the community and the number of tests that are done and so on. What we want is to keep this together and keep the centralized testing over the next 2 weeks and see where we're at. What we want, again, is to continue to see this flat. 2, what we're looking at also is what's going on around us in other counties around the state. 3, we're going to have to look at the national level. We will be reevaluating every 2 weeks where we're at, and the hope is that if we continue to be low and as the outbreak also goes down and abates in other communities, hopefully we'll be able to just move forward.
In regards to the reopening plan, is it possible to move backwards in a risk category if we had a spike in cases in Natrona County? And what would that look like for businesses such as restaurants?
The quick answer to this is yes. When the world shut down, it shut down because of a high mortality rate and a high transmission of the virus worldwide. And if the activity of the virus goes up again and we start seeing people getting infected and filling our hospital and maybe even dying of the virus, then we will have no other choice. And that's super important. That's why it's very, very important that people continue to work together on this, wear the face mask and adhere with the recommendations. It's a long way out of this, but we'll have to do it together.
In regard to the variances opening up outdoor and indoor dining in a limited capacity, Oil City News has the following question. Opening outdoor dining was discussed as a way to gauge whether relaxing restrictions would have a negative impact on COVID-19 cases. Will reopening indoor dining as early as Friday allow enough time to see what the impact of reopening outdoor dining has been?
I don't think that 4 days are enough to know whether we're going to have an increase in the activity. The opening of the outdoor dinings was felt to be a first step toward the opening of the indoor dining. If you look at our numbers, basically that would correspond to 14 days of no cases in Natrona County, and that's why we're saying this is data-driven. At 14 days of no cases or minimum transmission in our community, we feel that we're in a good spot to move forward. But again, it will be the next 2 weeks are going to be extremely crucial to know whether we're going to be able to keep moving forward and hopefully go to low-risk category and so on. This will be re-examined and evaluated.
Our last question today is from Will Thomas. Though restrictions are being relaxed, can you tell us what you would say to our community to make sure they are not letting their guard down about COVID-19?
I say look at what you guys have done over the last 6 weeks. I say look at other communities around the world and the devastation that has happened, and I say look at what you guys have done and what you have achieved. What the cooperation and the coordination of care and the public support has achieved is low enough numbers for us to feel really comfortable with opening up. If we stop doing what we're supposed to do, this virus is going to come back and it's going to be very hard to get it under control. So don't let your guards down yet, but moving forward, and that's how we should do it. All right, thank you.
At this point, this concludes our news brief for today. Thank you for joining us here at the Natrona County Emergency Operations Center. And as a reminder, you can rewatch this full briefing anytime on the City of Casper YouTube channel or Casper Natrona County Public Health Facebook page. We will also be linking today's graphs that Dr. Ghazi talked about on Facebook and YouTube. You can also view the latest local information, including the reopening plan and outdoor dining variants, on our website at natrona.info. Until we see you again, please keep yourselves and your family healthy and safe. Thank you.